Hi, I'm Dr. Renee Gasgarth, your friendly board-certified plastic surgeon here in Melbourne, Florida, and I'm so excited today because have an amazing guest with me, Christine. She's our awesome patient care educator who now is also my patient. So I thought, who better than to explain an abdominoplasty or a tummy tuck and what the patient experience is really like. So before we dive into that, I'd like to let you know that there is another podcast that Dr. Novo recorded, and it is about the technical aspects of an abdominoplasty. So more about what is it, who benefits from it, what the surgery is like. This is really just a chat between a new friend of mine and myself about what I want patients to know, and I thought that it's better coming from a patient who can really explain what her experience was like. So full disclosure, we did not practice this. I told her she can be 100% honest and say anything she wants, and she's really funny. So I may laugh, I may turn red, I may need a moment, but I want her to be super honest. And she also told me all questions are fair game. So Christine, I'd like to introduce you. So tell me a little bit about what brought you to work for the For Your Best Self and what your job is like at the office.
I do love working there. I've been there for 4 years. I love working there because I believe in what Dr. Saluja has as far as being there for the patient as far as dermatology, plastic surgery, cosmetics. I love the whole thing of it. Being able to help patients from all aspects is one thing that I really enjoy. So I've been there for like 4 years, and it's fun for me.
And for those of you in the community, Christine is also our outreach person. So if you are a charity sponsor and you ask us to participate, Christine's the one who makes those awesome gift baskets. And so that's how she and I started spend time together, because she helped me do a few things in the community, including the Candlelighters, which they have a gala coming up this weekend as well.
Yeah.
And so Christine, we know that the decision to have surgery is a huge one. I always tell people it may be one of the biggest investments, especially a working mom does, in terms of time, money, and energy. So how did you decide to make the decision to have surgery?
Well, I had been thinking about it for some time. And I would always debate on money. Is it the right time? I have children. My husband works, all the time. So I had to find the right time. And when this happened, like with COVID, my husband was able to stay at home and work from home, and my kids were older. And I'm like, you know what? I think I'm ready. I think it's all coming into play that I think I can go ahead and do it. So that's when we came to you.
And when did you start thinking about a tummy tuck, and what kind of research did you do initially?
It was probably like 3 years ago. And I just, I talked with Dr. Novo a few times, did some research online, didn't really find out what it was going to be like till I talked with you and stuff. But yeah, it was probably about 3 years ago.
3 years. And so that's what I also want patients to know, that we don't take the decision lightly, like both our office, us as surgeons, and we want you to be prepared. And so that is part of the reason why we have the podcast, so we can answer some of your basic questions. I think that one of the things I love best about Christine is what she also didn't mention is she did the hard work. So she really worked on diet and exercise, and she had been through a lot of, let's say, unfun medical experiences. And so she got to a place in her life where she was healthy, and that her family was really supportive, which I think is key to a great recovery.
Definitely. Having my husband home with me to help me through the recovery was the biggest thing, because for me to do that by myself, I don't think I could do it. It takes a lot of work. There's pain that are involved, especially in your back because of how we have to stand. But with having him around to help me get around was wonderful.
Right. And I think that, we're going to talk about pain in the postoperative. I think that it's all very manageable. I think most patients are surprised that it's not as bad as they thought. But I do think that you have to be prepared, have the right recovery time, and the right team that helps you at home.
True, definitely.
And so just in terms of choosing a surgeon, what would you tell patients about how to decide who the right surgeon for you is?
I would definitely look at the medical background that they've had. Definitely pictures from what they've done before and after. I did a lot of that. And then I really just have to say, working where I work and having both you and Dr. Novo there, that was like my main concern because you guys were there and I love both of you. So it was great to have both of you there.
And so I told Christine this and I tell everyone, we actually don't like operating on loved ones, family members, and patients that are well known to us. It's stressful in a different way. And so probably I made her jump through more hoops in terms of being like, are you really ready? And do you really want me to be your surgeon? Because it's not a decision that we take lightly. And I also try to give really blunt advice during our consult and probably go over a lot of the risks, benefits, complications, not to scare people, but to make sure they know what they're getting into. So I know this was a while ago now. Our original consult was almost
April.
Yeah, it was April. So months ago. But do you remember anything that I said to you in the consult that was a surprise?
I'm trying to think. I think we were talking about about the drains. We were talking about the drains. And I had heard terrible things about the drains. And talking to you, you told me what it would be like, but I heard bad things from the sides of you coming out and, really excruciating pain. And I'm like, that's the one thing I don't want to do. I don't want to have drains, but I'm glad that I did them because it turns out those were like my best friend to have was my drains.
And so we'll dive into the drains in just a few minutes. And so Christine's not sort of mentioning all the things that she did, but one of it is arranging time off from work.
Oh, definitely that. Yes.
And then also, her husband's super supportive, her children are super supportive, but they did a lot of things in the house too. So can you tell me kind of the 2 weeks before surgery, do you remember the things that you helped do to prepare?
I went ahead and purchased I know this is weird, but those like gowns that are just like a zipper gown, those things really work. I'm just saying, you buy these gowns and it's just a zipper, and when you go to wherever you're going, your doctor's office or wherever, you just unzip and that's it. You don't have to move around, and that was great. Another big thing that we had, I don't know if you want to get this or not, but the bed that we have, which was very supportive, it moves up and down. So it didn't take a lot of me to move up and down. The bed did that for me. So that was a really big thing as well. But definitely having the zipper gowns was a big thing.
And so what I will tell people, you do not need to buy new furniture.
No, you don't. You don't.
So actually,
we just happen to have that.
Yeah. But it does. So a lot of
well.
people have a recliner or have an adjustable bed. If not, I do think that you should invest in some good pillows, at least 3 or 4 pillows to help you. And you want to really kind of get your body right. So you want to eat healthy. We don't want you any blood thinners, any supplements, anything that you're on. We really want you to review with us to make sure. And so I know for you, we talked a lot about not doing ibuprofen, things for headaches, things for sort of back pain, and because we want to give you the best surgery we can, and we don't want to have an increased bleeding risk. And then I have told patients about your zip up front. So we always say to wear comfy clothes,
definitely,
but things that open in the front. So it can be a big button up shirt, it can be a zip dress, it can be a hoodie. I think those things really help you afterwards. And you don't want to plan on wearing expensive, fun clothes because
there's no need to wear them.
Yeah.
Not yet.
Yeah, not yet. Save those.
The biggest thing too was the wrap.
Yeah, the binder.
I did not think I was going to enjoy wearing that at all, but let me tell you, it became my best friend. Totally. I loved wearing that. Everywhere I went, I felt so secure and safe. And, Dr. Gasgarth you're really going to have to wean off of that now. I'm like, I know, but I just like it.
I know. So. I remember having that conversation. So things that people are worried about is usually, which she already mentioned, pain, drains, and the abdominal binder. And so these things, it's hard for me as someone who hasn't had this to really explain, but I think the horror stories that you find online are not always true. And if you have a complication, it 100% happens to you. So you do want to talk about things when they can go wrong and what can happen. But really, for the most part, it's a very safe surgery when done in a well-trained surgeon's hands in a well-trained facility. And so just a little bit about the day of surgery. So nothing to eat or drink after midnight. And what did you think when you arrived to surgery?
When I had went to Apollo surgery, that was my first time there, and the staff there was great. I liked them all. They were nice people. And then after, having my surgery and then coming to, they were also very helpful. I remember telling them, and I was a little bit out of it at the time, but I remember saying, "You guys are so awesome. Thank you so much for taking care of me." They were all really, really great there to be there.
And I think that they have a really great team. So we do our surgeries at Apollo Surgery Center. So it's 100% outpatient, and they hire really amazing people. We have board certified anesthesiologists, so I am not supervising a nurse anesthetist. That's a question that I get asked. It's a board certified plastic surgeon. Both Dr. Novo and I are really committed to having the safest surgery we can. And so we think that by having an anesthesiologist who's just focused on you, making sure that you're comfortable during surgery, that you have an easy recovery, that's all helpful. And then people are anxious that they're going to sort of feel like, if you've ever been to an emergency room and people are kind of stressed and not taking their time with you, the staff is not going to do that. So we're going to go over lots and lots of things with you, but the staff there will go over it as well. And then for my patients, I see them the day before surgery. So that's when she doesn't remember she was vibrating. She was so nervous, anxious.
Definitely.
And I usually give people something to help them sleep and for nerves the night before. So when you come to surgery, we want you to be feeling calm, rested, sure of your decision. This is elective, so if people don't want to do it or have second thoughts, I always tell them, then let's pause and rethink it. But the day of surgery, you should be in a good healing situation.
Yes.
It can be a long day for your loved ones, but for you, after you've met with me again, the anesthesiologist, you get some medicine to help you relax. You can have that cocktail on the beach, and then you get ready for Snow White's party. And when you wake up, you should be really comfortable.
I was, definitely. I was.
So people think they're going to wake up in 10 out of 10 pain. They're going to be miserable. They're going to be vomiting. Can't promise 100% of the time, but I would say 99.5% of the time, people really wake up comfortable. We use a long-acting pain medicine called Exparel, so that's an injection, and that has really changed things. That makes people so much more comfortable. Usually it's just where we repair the fascia. So in the midline when your tummy gets stretched out, the muscles themselves, we repair that. That's what's really uncomfortable, more than the incision itself. And then there's just sort of general discomfort. And so I want to add, Christine said it was okay. She had liposuction of the waist, and she also had a hernia repair. So when I tell you that she was comfortable, that's a lot for one person. And she was comfortable enough to go home. You're walking, you're talking, you're drinking.
Yep.
You're able to take care of yourself right after surgery.
Yep. It was a really good transition from leaving there to coming home. It was very nice. Very comfortable.
And so I think that's a big fear that people have. It's sort of, can I handle the pain?
Oh, yeah. The medicine that you had given me, like I said, from there to go on home, I was totally fine. I remember, getting home and going into bed with my husband's help, and I'm sitting there. I'm like, I don't feel anything. Is this normal? I'm not sure, but I didn't feel that kind of pain like I thought there might be. It was good. It was really good.
Right. And so I think the long-acting numbing medicine that lasts for 3 days, a combination of, I do use muscle relaxants, and then prescription opioid pain medicine really has people comfortable. And
definitely.
Most people take the prescription pain medicine for about a week, if that. Depending. Again, when you have a hernia repair, sometimes it's a little longer, but I think you were off of pain medicine in 8 days. Yep, 8 days.
Up to 7 or 8 days, yeah.
So just one extra day. And so I want to reassure people that pain is manageable, and it's more discomfort, and that you have to kind of stay on top of it. than it is true pain.
Yeah, if you let the pain go, I mean, if you don't take your pain medicine when you are supposed to, then the pain really sneaks up on you and it's harder to get rid of. If you stay on top of it, then you don't have that bad pain where you can't do anything about.
Right. And ice definitely helps too, especially the first 72 hours, staying elevated, which she did.
Definitely.
And then trying to be calm, not having high blood pressure. These are all things that really she had a great recovery. She was a model patient.
I went ahead and made sure I had all my movies taped. Just watched them left and right, over and over again. So yes, it was good.
And so I think for a lot of women, again, Christine's a working mom. This may be the first time that you've had kind of 2 weeks where you didn't have a bunch of responsibilities for people. And so the first week, you're sort of dealing with just the general discomfort. The second week is when people get into trouble and they start to feel much better.
A little bit better. Let's go ahead and let's do stuff. And then my husband's like, you can't do this stuff. We've already talked to Dr. Gasgarth. You can't do that. I'm like, yeah, but I'm feeling bad. But you don't want to push it. You have to move it. Yes, he was always on me all the time to make sure I healed correctly, the right way.
And so what would your advice be to people that second week when I'm like, nothing that gets you red hot, sweaty, flushed in the face, please chill. And they're sitting at home and they're ready to like redo the fridge, organize their closet. Like what was because she's very active like I am. We're both on the go people. How did you just sort of make it through that extra week?
Really, it was him. Like if I had stuff that I wanted to do, I would just ask him if he could like start it and then I'll finish it like later on. You know, I wanted to do like stuff in my closet.
I know. So, people get bored.
I know. There's like so much I can do around here and I was feeling better to do it. But to do it, for me to even try to, even for a little bit, the pain would be there, and I'm like, you know what?
That's your body
Maybe
telling you need to listen to your body.
Exactly. Yep. So I didn't do.
And so I want to reassure people that usually the second week you do feel really good.
You do.
And that's when we can sometimes get into trouble because people start to do too much activity. Things are still healing, and you need to give your body some time and space. So now let's talk about the drains. So.
Drains.
I actually Googled this and I couldn't find where people are reading these horrific things about the drains. So what did you read about the drains? Was it what they hurt when they were in there or they hurt when you took them out?
I didn't read it.
Okay.
It was friends of mine that had it, and they said it was terrible. It was like babies coming out of you like with, I don't know, with pain.
Yeah.
And I was just like, really? Oh my gosh. I don't know. I don't think I want drains. I don't want drains. But they were my best friend.
And so I use drains. There are a lot of plastic surgeons who advertise drainless tummy tucks, but I use drains, one, for just information about what kind of fluid you're making. That also is an early indicator faster than you'll know if you're bleeding, which could be a surgical emergency. But I also think it helps the swelling decrease faster. So if you don't do drains, you have to do extra plication sutures, and sometimes patients really feel each of these. They're uncomfortable because they push on the fascia, or in a super thin patient, sometimes you can see them until they work their way out. So that's why I use drains. But as Christine can tell you, the drains come out of the edge of the incision. They're secured in there very well.
Well, I just wanted to say too that I had pain medication before I went in to get my first drain out. I was hoping I was going to get both of them out, but no, it was only one. So I got one taken out, and I'm like, really? That's it?
Yeah.
I thought it was going to be terrible, but no, it was really good. And then the second week, I went to get my second one. I had some more medication and pulled the other one out, and it was fine. It was totally fine. It really was.
And you really don't have to take medication for it.
It just helped me at that time.
Yeah. But it shouldn't be painful. It's coming out of the edge of your incision, and so you're still numb there.
That was true.
And then the abdominal binder. So people are like, why do I have to wear something?
Totally. You really do. I mean, I know you think that it's not going to be a good thing to have around. It's going to be, maybe people might think it's constricting and they don't have, they can't move around as fully as they want to. But really, when you wear that and you take it off, you can totally feel a difference. I really enjoyed having that security there while I was healing. It helped. It helped a lot.
It minimizes swelling, so it helps provide basically literally what it is. It's a compression garment, so it helps support your body so that you're not getting too swollen, because when things are swollen, they hurt.
Right. Yeah.
And then what was your biggest surprise about your post-op recovery? Was there something that you were like, wasn't expecting that?
No, I mean, I guess I think that my biggest thing is that my stomach was gone.
Yeah.
I'm just like, it wasn't there anymore. I'm like, I'm like looking down and like, oh my gosh, it's not there anymore. That was like the best thing ever. I don't care what else could be, because that was wonderful for me.
Yeah,
it was.
And I do think tummy tuck and abdominoplasty really does something with a high patient satisfaction rate, because nothing else does what it does.
No, it was gone. It was all gone.
Once you have loose skin, we don't have any way to fix that besides, at this point, unfortunately, cutting it out. And so patients really feel much better right away, because you can look down and can see the results.
And it was gone. Yeah,
it's gone. I mean, it's gone.
I'm like taking pictures. Look, it's gone.
She may not remember, but believe it or not, the second week you look worse than the first week, because you do have a little more swelling. All of a sudden, your lymphatics start to develop more. You start mobilizing fluids.
Yep, you told me that, yep.
So the first week, people look really great. And so that's why if you look on Instagram, they'll be like, mommy makeover selfies, post-up day 1, 2. They have the drains in. Nobody shows that 2 weeks. So that's part of the normal recovery process.
That was true. That's definitely true.
And then let's talk about not just the tummy, but for most patients, they also have some extra redundant skin of the mons area. So the mons is kind of that area over your pubic bone. Mm-hmm. And so I always tell people, if it's okay with you, I'm going to make my incision low, and I'm going to do a little lift of that to help blend things.
And you had me try on many different bikinis or underwear that would help you to define where low could be, and that was very helpful,
right,
as well.
And so I think that's the other nice part, is that we can really choose where you want the incision.
Mm-hmm. Yep.
And I'll caution people like, that's a trend. Are you sure you're going to want to wear that in a year? But so that's the nice thing.
Yeah.
And you can have swelling in all the parts. You can have swelling in your hands and feet just from the IV fluids. Mm-hmm. You can have swelling even in your labia. If we do a little bit of a mons lift, and you definitely are going to have swelling. People are surprised at their hips and their back.
Yeah. No, I think it was, for me, it was good for down there. How well we did it with the underwear that I chose. I think it was good. It was perfect.
And Christine did send me, when was that picture from with your daughter in your bikini?
Oh, it was like 3.
Yeah, it was like 3 weeks afterwards, right?
3 or 4 weeks. Yeah, 3 or 4 weeks later when we were at the pool.
Right. So people really look great. And she knows, I give everyone a lecture. You got to put sunscreen on naked.
Yes.
Put it on all of the incisions. Be careful. There's no pools, hot tubs, ocean for 2 weeks. But after that, you can do a lot of things. There's just activity restrictions.
Yep. Yeah. I think that was 3 or 4 weeks. Yeah.
Yeah, it was 3 weeks. So what do you remember with the activity? So I have rules for 2 weeks, 6 weeks, 3 months. Do you remember what the activity restrictions were for you?
I remember you telling me that I wanted to go into a lake, and you said no lake.
Yeah, that was at 10 days. I was like, no. That's a no. So drains have to be out plus 24 hours before I let you get into a lake. I know. She was ready to show off the body, which is, that's what we want, right? We're so excited. But yeah, so 2 weeks plus, or if the drains stay in a little longer, which if you're good with the garment, you're good with activity, they really should both be out by week 2. So you can't go into lakes, ocean, hot tub, saunas during that time. And then different if there's a hernia repair, I'm a little more strict, but in general, after 2 weeks, you can start to do more exercise. So walking, things like that. You can do weights with your arms. And then at 6 weeks, you can do pretty much any aerobic activity you want to do, as long as at that 1 month checkup things are looking good.
Yeah, I think I waited like 2 months.
Right, but no core workout.
No, just like aerobic dancing or something like that. Yeah.
And so aerobic dancing, right at the 6 week mark, is fine, and then kind of 3 months before you're really working on your abdominal or fascial muscles.
Yeah, definitely.
And then another thing that we just talked about that is that a lot of patients haven't realized how stretched out their abdominal wall was. So one of the things that I get a lot of calls about are, 1, immediately postoperative constipation, but 2, bloating. So I think in the immediate period, constipation's normal, just from the pain medicine.
Yes.
And so you want to stay on top of that too. Stool softeners.
Yeah, you had given me some medication for that as well, and I did that, and I was good.
Yeah. So we give recommendations. So Colace is a stool softener.
Works.
You start that ahead of time, and then a lot of people, especially after a tummy tuck, do need laxatives. So I always tell people, if surgery is on Thursday, if by Sunday you haven't had a bowel movement, you just have to take something, milk of mag or magnesium citrate.
It worked.
And and then people ask me, like, do I need a bidet? Is someone going to have to wipe my bottom? I get asked these questions. So she can tell you, you don't need anybody. You got this. You're supposed to have a bowel movement. I want you to have one. You don't have to be scared of it.
No.
It's just like you had it before surgery.
I think more like I was more afraid to have to push.
Yeah.
With anything.
It's going to be okay.
Yeah, it worked. It totally worked.
It works. So, and when I tell people that, they don't believe me, but I have a patient here telling you it works. You'll be fine. You're supposed to do this. It's natural.
Yep.
So I get a lot of frantic phone calls about that. Like, I'm afraid. I'm like, don't be afraid. You got this. I repair my everything in layers. So I do figure of 8 sutures, and then I also do a running. So I tell people, like, you can push. That's the whole point. That's why I do 2 layers. You can push. It'll be okay. Yeah. So that's one. And then the bloating thing. So women in general who come to me for a tummy tuck have had children or changes in weight, and they've really stretched out their abdominal wall. And so they don't notice if they're bloated. They can't tell. Everything's just so loosey-goosey, stretchy, they don't feel it. After we put things back where they're supposed to be, all of a sudden you can feel when you're bloated. So it's pretty common for people to tell me, if I have carbonation now, I notice that I'm bloated. I never had that problem before. What did you do to me?
That's what's happening.
Yep.
Yeah. I feel that as well. At times, like I'll have like a drink that has, the Celsius drink that I love, and I drink that, and I'm like, what's wrong? That never used to be like that. What happened? So I have to rearrange my drinks and not drink that because it does not work for me.
Yeah. So these are all the things no one tells you, right? I actually, when patients ask me, I forget to tell them ahead of time about that, but you will notice if you're bloated because you couldn't before. You had so much laxity.
Right.
You could have never expanded to the space that you had stretched out with that 9 or 10 pound baby, or with losing that 50 pounds that stretched your inside out slowly, gradually. And so, but after surgery, we've really put everything back where it's supposed to be, and you will notice if you have bloating.
Yeah. I gotta redo my diet.
Yeah. And so, like all things, having a healthy diet really helps with that. So making sure that you're regular, so fiber, water. And so, believe it or not, I think that's why a lot of my patients lose weight after a tummy tuck. It's not a weight loss surgery, right? We're not doing that for that reason, but they all of a sudden are paying attention to their body a little more.
Exactly.
So they notice, like, if I eat McDonald's, I don't feel well. Right?
I don't even go there.
Yeah, I know you don't go there. She's good. But if I have a bunch of carbonation, or if I have, it doesn't feel good. If I eat a lot of processed foods, I don't feel well. And so I think people forget that. Their body's kind of just a little out of balance. And then resetting with surgery, being careful about diet, all those things really help. And then, otherwise, what I want patients to know is that it really is a commitment from you, your friends, your family, your tribe.
Totally.
So I think that what we talked about a lot is that time off from work, because obviously she works in the office with me. And so I was like, you may be ready at 1 week, but you have light duty. So you can't carry these heavy gift baskets. You can't restock the waters.
No, and I must say, when I went back to work for the first time after my surgery, and I saw everything that I'm supposed to do, my body could not do that. I had to literally kind of work my way back into doing that, probably just for another week. And then I was more able to go ahead and do what I was supposed to do. But when I came back for that first day, I'm like, I did all this stuff. My body can't do that right now. I gotta take a little break. But by the next week, I was better.
Right. And so I think that's why I tell patients 2 weeks off of work, because you may need some accommodations. Obviously, for you to go back to work, you just have to be off of pain medicine and not have a super physical job. But if you have a complicated recovery, you may be off of work. And so you want to think about that. One,
True.
you want to listen to me and be good. Christine was like the perfect patient. Do what you're supposed to do. Don't be crazy. If you think to yourself, Laura, my patient care coordinator, always goes, she says, think to yourself, what is mom, aka Dr. G, going to tell me? Am I allowed to do this? If you ask that, the answer is just like I tell my son, no. If you're not sure if you're supposed to do it, don't do it. When he's like, can I jump off of the table?
No.
What do you think I'm going to say? No.
No.
Yes, that is correct. So let me be that little voice in the back of your head that says, like, maybe I shouldn't do this.
Right.
And then if it says, like, well, I wonder if she's okay if I do this, the answer is probably like,
No.
hey, can I go in this lake?
No.
No. If you have to ask the question, you already know the answer.
I know there's a lot of stuff in there, but can I go just in case?
Yeah, just in case. Yeah, the answer is no. But then you'll have a better recovery. Then you'll be
Yes.
back to work. You'll be feeling better, and your results will be better.
That's totally true. That worked out really well for me. The instruction that you gave me and I listened.
Yeah.
Worked.
Yeah. And so, but I do tell patients, which I talk to Dr. Saluja about it too, is that it doesn't matter if you're in our office and we need you. If you're not ready to go back to work, then I won't give you the medical clearance, even though she sometimes is my staff in the front desk. I'm like, if you're
really
not,
can't go back. No, I need another day or two.
If you're not ready, you're not ready.
Right.
And part of that is just knowing that you should listen to your bodies and that every healing process. And so I've seen sometimes people push the envelope a little bit and then they're just miserable, or they have something happen, they tear a stitch, they clean out their fridge and they actually separated their belly button from the wound. I've seen it all now. And so that's kind of why I'm strict about that. And how do you feel now? Like, would you do this 100% again?
Absolutely. Absolutely. I have people that ask me about it. Patients that come into our office, if they have questions about it, I'll bring up that I had my surgery with you and they ask me, where we had it. They ask me all those kind of questions and I have nothing but great things to say because it was a great experience. Yes, you go under surgery and you have that, but it was a great experience and the recovery was great and I feel like this. Which is great. And
interesting enough, so I love that she sits at the front desk with another person who had surgery with Dr. Novo.
Yes.
So I can honestly say everyone that Dr. Novo operates on would say the same thing in the office, which is that we really care. We're going to give you good advice. We're going to take our best work for you, even if we don't know you, right? I mean, and then at the end of it, a lot of my front team will say, like, your friend called. And in some ways, we do become friends.
Yes,
we get to know a lot about each other. We spend a lot of time together.
Yes.
And so I would say we're friends now.
Yes, absolutely. 100%.
I put her on the
friend.
spot.
You're my friend.
She asked if we could go to lunch after this. So when I say, like, I think we really are friends. I think we're friends now. And it's a special relationship that, we're really excited about. And she has a beautiful result. So her before and afters are going to be posted online. And so you'll get to see them and kind of, and that's the nice thing is that we want everyone to be open, honest.
Yeah, I definitely have to look at them because I look at them and I can't believe
And people forget.
Yes.
Forget.
Yes, from what I was then and now I'm like, I look so great.
And she was prepared. She did the hard work and she was. So if you could give one pearl besides her Amazon zip ups, which I have the screenshot of that if you need it, everyone. What's one pearl, one thing that you want patients who are ready to have a tummy tuck to know?
Well, if I can say this, the elastin reform that we had used, wonderful stuff for me.
Yes. I already forgot about that. See, this is why she's awesome.
It is awesome for my stomach. I used on the top part. I used all the way around my side. I also used our elastin nectar. That kept the area really great, like nice and I don't want to say moisturized, but.
That's awesome. And see, this is why she's here. This is why she's a great patient care educator.
It was really great to have that products that we have there that really worked for my scar.
Right.
I will say.
Elastin Repair and Reform is a product that has basically it's going to prime your skin both for the 2 weeks before surgery and then also for healing afterwards. And it's safe to put on the incisions themselves. So there are very few things that I will let you put on the incisions themselves early, but the Last and Repair and Form is one of them. And my patients who have used it, especially for areas that are just a bigger surface area, have really felt like the swelling went away faster.
It did. It worked well. It worked very well. I even use it now for my thigh area. Yes, it's a really great product. I like it a lot.
Yeah. So that's excellent. That's a good pearl. And note to self, I should mention that to patients. Something to add. Good job.
Thank you.
All right. Well, I am so happy that you were here. I had a great time.
Thank you so much for having me come.
And I hope that everyone learned something, and we look forward to talking to you next time.
Definitely.
If you guys like the patient care experience, let us know, because we have lots of patients who are happy to share their stories, and we'd be happy to do this again.
Yes.
Thank you so much.
You.
Bye.
Bye.